All right, so this discussion topic is, why does it take multiple professionals from different backgrounds to help one person? That's a good question, and I think it's something that we focus on all the time. The next level, one of the quotes I think we say to every single person we talk to is that it takes a village. And I think it's for some obvious reasons, some reasons that people don't think about, but the truth is that when you get to the point where you're requiring treatment for a mental health concern or substance use disorder, it's so complex, and that one person may not have all the answers or the solutions to it. And usually you need to take a holistic view at the person and see, how do we treat their mind, body, and soul? And that usually requires multiple perspectives, multiple professionals with different backgrounds, so that we can sort of attack it from all angles, because we have to recognize as professionals, I can't be everything to one person. Absolutely. And we need to collaborate and have help.
Absolutely. I think that how we look at each situation and, do the assessments, and on the front end as a team, recognize, what we need to pull in, like what kind of, where we're lagging, or if we're working with someone for longer term, which we love and prefer, let's see, after month one, what's working, what's not. Oh, they're having this is starting to present more, so why don't we add this piece in? And it just, when there's a team that communicates and collaborates, for an individual or for a family, we just are seeing results long term and creating lasting change in people that have struggled for a long time.
I see a lot of patients and they go to their primary care physician. Their primary care physician sometimes is great and they'll refer out, and oftentimes they're not that humble and they think they could treat everything.
I'm not going to go to the dentist for, my general, medical exam, so we have to have all of it, treat the whole. I think that it's so valuable what you add to our weekly clinical sessions.
I was thinking the same thing.
Yeah, I mean, you've brought some things, maybe I haven't even shared with you personally, but I've shared with Blake some things that have really completely changed and really worked in the systems. And they're just things that Blake and I wouldn't have thought of. They're not how our brains work, but having you involved and having, you've helped just come from a different perspective. We're like, wow, and it's made huge changes in these people's lives.
I love that it's an open environment. Nobody's getting insulted with the suggestion. All of us are open to hearing what the other person has to say, and you're not saying, wait, I didn't think about it, so that's wrong. No. And there are some atmospheres that you can get into where treatment teams feel that way, where they're led by one person who's the doctor and everybody's supposed to just listen. Mm-hmm. And you don't get very far that way, unfortunately.
No. And thank you for, listening to what we have to say and valuing our input too in the cases. It means a lot that you value and respect our expertise and experience as well.
Just to build upon what you're saying too, though, I was thinking, I started with him and then I started expanding it out of how many times I've learned from just little things that you guys have said, both of you, but then everybody we've worked with, or just people in passing, or just being open and having vulnerable conversations about certain different topics, and picking up little tidbits of going like, oh my God, I never thought of that. That's going to work for so-and-so. This would be a good place to go. So being open to the idea of removing our ego from helping a patient and being open and willing to accept advice and concepts from other people is just so beneficial to the client, which is ultimately what we're swearing to do. Is we're trying to help the client. That's why we're doing what we're doing. It's not about us, it's about them.
I never want to be a professional that ever thinks that I know all of it. I want to continue to evolve and grow, and I know that we are all like that, and I want to always continue to collaborate, and always believe that we're a team. People that work quote unquote for us really don't work for us, they work with us, and that's how we are. We bring in everybody. We like to hear everyone's input, no matter what their role is with the individual, and I think that helps us make a difference.
The smartest people are the people who surround themselves with the smartest people.
Love that.
Boom.